Mutual Insurance Company of Arizona, MICA, and we're going to talk about workplace violence and physician safety today. Okay, this is not going forward. That's what I was pushing. I don't have any financial disclosures, and I'm not an attorney, so please don't ask me for legal advice. I could make something up, but chances are it wouldn't be good. Today we're going to talk about defining types of workplace violence, recognizing warning signs, and how to understand some basic methods to prevent workplace violence. I'm really sad that we're talking about this, but I'm glad that we're talking about it. It's a horrible topic, and I think it's just a sad state of affairs that we have so much workplace violence in the healthcare industry. But I think it's important to talk about it up front so we know what to do. If you think of any questions, please write them down. We'll take them at the end. All right, so what's the problem? One is we need more doctors, plain and simple. There are simply not enough doctors to go around, and that causes the doctors to have to limit the time that you can spend with your patients. Physicians, advanced practice providers, nurses, medical assistants, and office staff are just stretched really thin, and patients get really frustrated by that. The internet, unfortunately, has become a trusted source of medical information, whether it's trustworthy or not. Your patients seem to have a lack of empathy and patience anymore. This is something that we were seeing before the pandemic, but it has definitely gotten worse since 2020. I don't know if it's because people have lost kind of the personal connection with one another, or it's just social media and different types of things that we see all the time, and we're being desensitized or something, but there's definitely a lack of connection there now. And filters have been removed. People are more likely to say whatever they want to than they were 5, 10, 20 years ago for sure. Almost half of workplace violence occurs in a healthcare setting. 40 to 70% of healthcare workers have reported physical or verbal abuse. Physicians, APPs, and other staff are the targets of violence in their workplaces far more than most other professions and workers. The majority of injuries from assaults at work that require people to take time off from work occurred in the healthcare and social services settings. The Department of Labor and Justice say workplace violence is underreported, and rates of violence are much higher in this industry. And again, a sad state of affairs. Types of workplace violence, there's several. Verbal threats are the most common, and I think you can see that pretty much anywhere you go. Harassment or bullying type of behavior is next. And you can see these things just kind of escalate. Intimidation or inducing fear or a sense of inferiority on people is very common as well. And then we escalate into physical threats. Physical abuse, believe it or not, 1 in 5 healthcare workers has reported suffering some sort of physical abuse at the workplace. And that includes co-workers, employers, and patients. And then there's active shooters, or we could call them armed intruders. Obviously, this is the worst case scenario, and we have seen it in the news. We see news that physicians and other healthcare professionals have been shot and killed, and it's just, we obviously want to know what we can do to head this off. So what are the reasons? We have to look at this from an objective standpoint. The reasons for, and we're just going to focus on physician versus patient, patients in the workplace taking violent acts against healthcare staff, okay? Patients get angry and aggressive because they have feelings. People get angry when they have a sense of perceived loss. They feel like they've lost time, they've lost their health status, they've lost money going through a process of care, and if they have an outcome that they disagree with or that they don't feel is satisfactory, they're going to be angry and feel a loss. And the next thing would be a sense of unfair treatment. So if you have a patient who is of an ethnic background, insured versus uninsured, wealthy versus not wealthy, something like that, they may feel like they've been treated differently from other people in another class. People need to know that you see and understand their situation, right? So if they don't feel like they're connecting, like I said, we don't get connection with people anymore. If they don't feel like they're connecting and being heard and that you understand them, they're going to get more angry. A lot of times we hear this statistic, and the seconds keep getting shorter. Patients will talk for an average of 2 minutes and tell you everything that they need you to know. And then most physicians, though, will listen for an average of, and it started out at 21 seconds, it's gone down to 18, 15, it's like 14 seconds now is how long a physician will listen before they interrupt the patient. The patient wants to be validated. They want to know what they feel, see, hear, think is valued. And if they did go out and do a Google search, they just want to know that you understand that they did that Google search for a reason and that they think that these symptoms fit this condition for some reason. Patients can get aggressive when they feel unheard, right? So they don't feel like you're paying attention. They don't feel like their healthcare professional is doing all they can to hear what they're telling them. They feel unimportant. Think about that. The patient in the medical practice feels unimportant. That's sad. So we have to think about that. Now, again, this is in a scenario where maybe the patient is being unreasonable. Maybe there's a lot going on. They spilled their coffee on the way to work, and their kid's backpack got lost, and the dog threw up on their shoes, and they were already in a mood. And so they're just feeling aggressive or angry that day to begin with. But either way, they feel unheard, maybe unimportant, and they're feeling increasing frustration with no potential resolution. Okay, trivialization. I call this also acceptance. I've worked in healthcare with physicians for more years than I care to admit, starting in 1987. I was 2. People will say it just comes with the territory. It's just part of the job. People get angry. It's just how it is. We can't do anything about it. Or we excuse the behavior. Oh, their aggressive behavior is because of their illness. They don't feel well. This is all that's going on. They take responsibility. If I treated them more effectively, they wouldn't act like this. It's okay because nobody was hurt. It's not okay. It's not your responsibility. It's not your fault. And there's a phrase that I use fairly often. It's not your fault, but it may be your problem, right? So if the patient was already agitated when they got there, and then they acted out, they took out their aggression on the front office staff, what have you, it may be excusable, but not in that setting, right? You shouldn't ever have a staff member, a physician, a nurse, an APP, anybody who feels like they're going to be physically harmed. Excuse me. Reporting violence is perceived as a kind of a taboo. It's it is and has been perceived as an indication of incompetence. And it's not. Reporting violence is simply reporting violence. It's reporting something that shouldn't have happened. All right, who is vulnerable to workplace violence? Front office staff. Quick story, I told you I was working in healthcare in 1987. I was a receptionist for a large radiology clinic in Phoenix, and we had a patient come in who didn't have an appointment. We were trying everything we could to figure out where they were supposed to be, because they weren't supposed to be in our office. So maybe they were supposed to be across the street at the hospital or down the road at the other clinical diagnostic radiology practice or somewhere, but we were trying to help them. And the more we talked and the more we did, the more agitated the patient got. So I can presume at this point that I wasn't doing something right. I wasn't making the patient feel more comfortable or something. And I've learned a lot since then, so that's probably true. And the patient just said, "You just don't care." And they picked up the clipboard and threw it at me. Like, whoa, excuse me. Back then, that was my fault. And that's the kind of thing that we're talking about. It wasn't my fault. The patient shouldn't have done that. I should have had some better tools in my toolbox to handle that situation. Maybe it wouldn't have escalated. Maybe it would have. But now we recognize the need to back up our staff. Billing staff can be the brunt of the verbal abuse. Usually they're talking with folks on the phone about their bills. And they not only have to explain why the patient owes this money, but also have to explain why the insurance that they pay so much for didn't pay the bill. The back office staff might get blamed for the lack of a prescription being filled at a pharmacy, even though the back office staff or the nurse or whomever is responsible for that in the office sent the order. But the pharmacy didn't receive the fax, it didn't get processed through, something was wrong with their insurance, something happened somewhere along the way, but your office staff is getting blamed for it. Management gets blamed for pretty much everything. I can attest to that too, and that was another case of not my fault, but definitely my problem. Resident physicians get more than anybody else. They are the target of violence more often than anyone else on this list. And that's because they're not only learning in a clinical setting where often it's an underserved population, they're learning from people who may have less patience, PATIE and CE, than they might, and maybe they're aggressive or abrupt with the resident. But they're also dealing with the patients who may be in a not great situation. So the next time you see a resident, be nice. Risk factors. Who is more likely to act out in a violent way? Folks who have past behavior of violence or aggression, or non-compliant behavior. It could be they're non-compliant with their medications or following up with care and things like that. That's all indications that they're at higher risk of acting out like this. Patients or family members who are having a negative reaction to a bad medical diagnosis. When somebody is diagnosed with cancer or some dread disease, that's a very emotional moment. They may act out. The family member may be in instant denial, or it may be somebody that has had this diagnosis for a long time. They're getting toward end of life, and the family member is still just really angry about it. They take it out on you. Patient or family member may be impaired, or you may see drug-seeking behavior. These are all indications that folks may be more likely to act out. Socioeconomics, level of education, and especially level of health literacy also feed into this. If I was a patient and I was, decently educated, say I have a high school education, but no background in medical anything, I might have a hard time understanding all of the medical jargon that we have to say to patients to tell them what we have to tell them. So they may feel vulnerable and inferior in some way. Okay. Warning signs. When folks get anxious, agitated, restless, they're glaring or staring at you. I've felt the cold stares from the front office. Yeah, they're sitting there looking at you. I have waited for 10 minutes past my appointment. Okay, now it's 20. OBGYN went to the hospital. How long are you gonna be there? You'll see people get up and pace. You'll hear raised voices, aggressive body language. People are standing there with their folded arms just glaring. And, even throwing a clipboard in frustration. If you do encounter somebody who is acting like this, document objectively their behavior, standing with arms crossed, glaring, raising voice, and quote said, "You don't care about me," or whatever the statement might be. When a patient is argumentative and belligerent, it's hard to reason with them, so be aware of that. Here's an acronym you can use, STAMP. It helps to kind of just cement what I just talked about: staring, tone, anxiety, muttering when people are talking under their breath and maybe criticizing staff, mimicking staff, yeah, you're so nice, and pacing around in a confined area. It's really like animal behavior, right? People are getting more and more agitated. It's a warning sign that something could happen. De-escalation. This is what I didn't know how to do back then. Shorten the wait if possible. If that person has been waiting in the waiting room for 20 minutes and it's past their appointment time, and I, as the receptionist, know that patient's going to wait another 10, 15, 20 minutes, I'm going to go and talk to the patient and say, "I'm sorry for your wait. Can we reschedule? Would you prefer to wait or, come back another day, go get a drink," something like that. Use calming language. This is the tricky one because it can sound condescending if you don't do it well. "I understand that you're upset. How can I help?" Instead of, "I know how you feel. What can I do about it?" Because you don't know what I feel. You're not in my head. You're not in my heart. You don't know how I feel. So I don't say that. But I understand that you're upset. What can I do to help? Practice active listening, eye contact, letting the person finish speaking, show you're interested by your body language, and take the problem seriously. A patient code of conduct goes a long way toward preventing escalation because when you let the patient know what is expected and what they can expect, it helps a lot. It sets limits for their behavior. It sets consequences for their behavior and yours. And in the code of conduct, it'll clearly state prohibited behaviors, like don't shout or cuss at my staff. Consequences are you can dismiss that patient. Expectations, work with your care team. Please pay your bills. You're going to encourage compliance with their treatment plan. Create a culture of safety. Empower your staff. If they see something, they should say something. If they notice that someone is becoming really, gosh, Mrs. Smith over there is really not feeling happy about this, or her son is really upset about this weight, or Dr. A or Dr. B hasn't done what they think they should have done by now, they should speak up. Run training and drills with their staff so that they can recognize the emotions, practice communication techniques, and they they should have some sort of measures for dealing with aggressive behavior. You know, they need to be empowered to use those. Understand the employer's responsibility in providing a safe work environment. That's super important. It's not malpractice, but it's employer practices liability. And if the employer does not provide a safe environment for the employee to work in, then the employer can be responsible, even though it wasn't their direct act. Okay. We have a few minutes if you have any questions. Does anything come to mind? Have you seen any active, angry patients in your careers? I bet you have. No questions? All right. Thank you very much. I appreciate your time today, and I hope you enjoy your dinners. I hurt my knee at the airport. Thank you.